Well, just hearing the word root canal will leave anybody cringing, but what if there was an alternative? Dr. James Bahcall is a board-certified endodontist with the University of Illinois College of Dentistry, joining us now to tell us about one that he is performing. Welcome.
Thank you for having me, Sylvia.
You say root canal and everybody's going, ooh, that's like the first response. Okay, before we get to what your alternative is, let's talk about what exactly is a root canal. Why does the average person need one?
A root canal is basically when the tooth's nerve becomes inflamed or infected, and the dentist or the endodontist who specializes in root canals removes that nerve from within the tooth.
Okay. And you know, because we start feeling pain, really horrible, right?
It's usually pain to cold or swelling from the infection.
Okay, and so a normal root canal involves what?
It involves, once again, and I want to note that root canals today are very safe and effective procedures, and patients can be very comfortable in having it done. But basically, they're done under local anesthetic where we remove the tooth, that's the nerve, which is either inflamed or infected, and then they replace that area that they remove in the tooth with a rubber material called gutta percha and a dental sealer, and then they restore the tooth. And the advantage to root canal treatment is the patient's able to keep their own tooth.
Okay, and this is what we've been doing for a while, but now let's talk about what you are doing. Tell us what the name of it is and how it works.
Well, we developed a new procedure called Pulp Cryotherapy at the University of Illinois College of Dentistry. And to best illustrate this, I brought a tooth model, and this brown represents tooth decay. And when this decay gets either near or into the dental pulp, which is the technical term for the tooth's blood and nerve supply, we anesthetize the patient with local anesthesia. We remove the decay, and then we place sterile ice on the pulp tissue. And this is the cryotherapy portion of the treatment. By lowering the temperature of the pulp tissue, the blood and nerve supply, we see a reduction in inflammation. Also, we see postoperatively that the patient has a much better post-op reduction in pain.
Okay, we're looking at this video that you sent us. So you look right here on the screen. And this is actually an ice?
The application of sterile ice right over the tooth and the exposed nerve and blood supply, which is the pulp tissue.
Okay.
And by doing so, like I said, this reduces the inflammation and also post-operative pain for the patient.
Okay, I'm watching this. So what's the advantage for me as a patient using this versus their traditional method?
Great question. Well, in root canal treatment, as I mentioned, we're removing the entire tooth's blood and nerve supply and then replacing it with a rubber material called gutta percha and a dental sealer. With Pulp Cryotherapy, we don't have to remove the pulp tissue, and after the patient is properly anesthetized with local anesthesia, the procedure is only 10 to 15 minutes to complete.
What, 10 to 15 minutes versus?
1 to 2 hours in multiple treatments.
Okay, so how much more expensive, or is this actually cheaper, would this be for the average patient?
Well, it is, and at the university, I don't look at the financial, but yes, it is significantly cheaper and a more conservative approach. But I will point out, Sylvia, that it's important to note that there's certain patient guidelines that have to be met in order for us to perform this procedure.
So who's the perfect patient for this?
Well, the perfect patient is somebody who has dental decay that's either in or near the dental pulp, once again, the tooth's blood and nerve supply, but also that the tooth can be restored with a permanent restoration such as a composite, which is a tooth color material, or a silver filling. If the tooth has to be prepared with a crown, it's not an indication for Pulp Cryotherapy.
So now my next question is, there have been over the years so many new advances in different areas, including dental, but I think about orthopedics specifically, where they're saying, oh, look, this is a less invasive and a much milder way about going, and then people find out later they have to end up doing the whole thing anyway. Is that a risk with this?
Well, there's always a chance anytime you touch the human body, how it's going to respond to treatment. Ideally, we always tell the patient up front that if this procedure, Pulp Cryotherapy, doesn't work, that would go to a phase 2 treatment, and phase 2 treatment is doing the complete root canal treatment.
Well, I have to tell you, if you were to ask me which one I wanted, I know what my answer would be. So is this available to everybody now, or just at your place, because you guys are the ones who actually created this?
Right. Well, right now, it's exclusively because we developed the University of Illinois College of Dentistry, but in any new dental procedure, it takes at least a year or two before it becomes mainstream within the field of dentistry. So we'll be seeing this procedure within the United States probably the next year or so on a regular basis by people's dentists.
Okay, and I'm curious again, the cost difference then? What do you, once it gets out there, what do you think it's going to be? I mean,
it's a big
variance. Want to know money.
Probably $1,000 to $1,500 less expensive.
Wow. And 15 to 20 minutes.
Yes.
Versus 1 to 2 hours.
Correct.
Sign me up, right? Wow, that's really fascinating. Thank you so much for coming and sharing. Very interesting.
Thank you for having me,
Sylvia. And where can people go for more information?
The University of Illinois College of Dentistry.
Okay, very good. Thank you so much. Nice to meet you. How interesting was this? Glad we had you on to explain. Okay, still to come, a surprise that is for some teens on the South Side.